The transition to fatherhood is a complex process that varies between individuals. The development of the parental-infant bonding is important for development of future relationships. Knowing what is happening with your baby and if it is normal and how to keep them safe is an important and essential skill. This PowerPoint will help you to understand what is normal in your newborn's life and how you can help them stay safe and develop well. This includes infant feeding and sleeping patterns, keeping them safe in the car and while they sleep, bathing newborns, their elimination habits, and how to settle them when they're being fussy, as well as the important medical things like immunizations, neonatal screens, neonatal jaundice, and their healthy hearing check. Most newborns will sleep for 16 to 20 hours in a 24-hour period, waking every 2 to 4 hours for feeds. Every baby's sleep schedule is different, and you shouldn't impose rigid schedules in the first few months, as infants have varying sleep-wake patterns and will take time to demonstrate a normal pattern. Some babies will often wake during the night to be fed, as infants have small stomachs and need to be fed frequently. Breast milk is easily digested, and it is common for babies to feed for up to 12 times in a 24-hour period. If you feel your baby hasn't slept for a long period of time, you believe they're due for a feed, or they are not waking as normal for a feed, there are various ways you can wake a baby. This includes changing their nappy, giving them skin-to-skin contact, giving them a bath or giving them a massage, and stroking their hands and feet. By day 2 or 3, you may notice your baby is feeding more frequently than normal. This is known as cluster feeding, and is more common in the late afternoon or early evening. You may find in this time your baby has short breaths, frequent feeds, and is very fussy for no particular reasons. If you and your partner have decided you are not going to breastfeed, but rather formula feed, there are a few important steps to implement. Formula requires accurate and hygienic preparation to ensure it is safe for your baby. Always wash bottles and teats. Boil fresh water and allow it to cool until lukewarm. Always prepare only one bottle of formula at a time. And always read the instructions on the tin to ensure you are using the correct amount of water and formula. Add the water and then the formula to the bottle, ensuring you prepare it exactly as the label says. Place the teat on the bottle and shake until all the powder is gone. Always test the temperature of the milk before you feed the baby, and never leave a baby unattended with a bottle. Sudden unexpected death in infancy, or SUDI, refers to all cases of sudden and unexpected death in infancy, including sudden infant death syndrome and fatal sleeping accidents. There are many steps to implement that ensure your baby sleeps in the safest way possible. These include sleeping baby on their back from birth, with their head and face uncovered, and in a smoke-free environment. It is safest if a baby is sleeping in their own sleep space, in the same room as an adult caregiver for the first 6 to 12 months of life. A safe sleeping environment is one that includes a safe cot that meets national standards, a safe mattress, one that is firm, clean, flat, and the right size for the cot, and contains safe bedding. Soft surfaces and bulky bedding increase the risk of sudden infant death syndrome. The baby should be placed with their feet at the bottom of the cot. If it is necessary for you to share a sleeping surface with your baby, ensure the baby is not wrapped or swaddled, that they have their own linen, and that the adult bedding cannot cover the baby's face. When co-sleeping or bed sharing, it is important the baby is placed on the side of one parent and not between two, and that the baby is not placed between an adult and the wall. As it is always important that the baby is never left unattended when on an adult sleep surface. When in a car, children under 6 months old are to be seated in a properly fastened and adjusted rear-facing car seat. Before your baby is moved into a front-facing seat, they should be able to sit and control their head. It is illegal and dangerous to place a baby in a rear-facing seat in the front seat of the car with an active airbag. It is important to always use a seat that is appropriate for your baby's height and age, and to ensure it is fitted properly. Never leave a child alone in a car, even on cool or overcast days. The temperature inside a car can rise to dangerous levels very quickly. A child car seat or capsule is not a safe sleep surface. They do not provide the space around a baby's head to allow for safe sleeping, and falls from unrestrained infants in car seats used outside the car as infant carriers are common and represent a significant source of head injury. You do not need to bath your baby every day. Just ensure that the nappy area is kept clean and dry. When you do bath your baby, however, it is important to do it in the safest way possible. Prepare everything in advance, including towels, nappy, and clean clothes. Remember that babies have sensitive skin and it can burn very quickly and easily. The safest temperature for a baby bath is 36 degrees Celsius. When your baby is in the bath, stay within arm's length at all times. Even if you are using a bath seat or cradle, these are not designed to keep your baby safe in the water. Always empty the bath immediately after use. Your baby may come home with their umbilical cord still attached. This is normal, and as long as you keep it clean and dry, it will fall off on its own accord. When bathing your baby or changing their nappy, always check their umbilical cord for any signs of infection, such as weeping, redness, swelling, or if it is hot to touch. If any of the above occur, contact a medical professional. A newborn baby will urinate 2 to 6 times in the first 24 hours, and it is expected that at day 7 they have 4 to 6 nappies per day. Monitoring your baby's urine output and number of bowel motions is a good way to monitor that your baby is healthy and well nourished. In the first 2 days, a baby will have 1 to 2 dark black tarry stools, known as meconium. By day 4, this stool should be a transitional green or brown colour, and between day 4 and 12, it should be a mustard yellow colour and be passed with almost every feed. After day 12 onwards, a breastfed baby may not make a bowel motion every day. As long as they are gaining weight, feeding well, and passing urine, you know that they are okay. However, if a formula-fed baby is not passing stool at least once a day, it is important to get them checked by a doctor. Babies can easily go from their often placid, content self to crying, unhappy infants in a matter of seconds. It is not known exactly why babies do this. Often these periods of unsettledness begin between 4 to 6 weeks of age and start to reduce again at 12 weeks of age. It is likely that there is no specific reason for your baby's crying and unsettledness, and this is known as colic. Newborns have to adapt to a variety of changes and stimuli after birth, and it is thought that some of this unsettled behaviour is caused by overstimulation, as some babies are unable to cope with the changes around them. Some babies may be frightened by normal physical sensations such as digestion and mild reflux. There are many techniques to aid in helping settle your crying baby. These include holding them close to you, cuddling them, feeding them, gently rocking them, giving them a warm bath, or just being close to them. It is important to understand that your baby is not crying because of something you have or haven't done. If you are starting to feel overwhelmed with your crying baby, always reach out for emotional and practical support from family and friends. If your baby is crying and unsettled for most of the day or seems to be unwell, contact a health professional immediately. Wrapping or swaddling is a useful strategy that parents can use to help settle their babies and ensure they sleep on their back. Though there are a few things to consider when using this technique. Always allow for your baby's hip movement and chest wall expansion when wrapping them, and ensure that the baby is not overdressed under the wrap. Babies aged between 2 and 3 months should be wrapped with their arms in the wrap to reduce the effects of their startle or Moro reflex, while an older baby, older than 3 months, may have their lower body wrapped with their arms free to allow the baby access to their hands, which promotes self-soothing. It is important to stop swaddling when your baby attempts to roll. In Australia in 2018, 1,523 children under the age of 4 contracted pertussis or whooping cough. Immunisation is a proven and effective public health strategy aimed at preventing outbreaks of vaccine-preventable diseases, such as whooping cough. It has helped maintain and protect overall community health by reducing the spread of these diseases. Immunisation not only protects those who have been immunised, but those who are unable to be immunised due to their health or age. This coverage is known as herd immunity, and it is a benefit to the whole society. The National Immunisation Program is a series of immunisations given at specific times throughout life. In Australia, all vaccines on the immunisation schedule are free, and to ensure the best protection, they are to be given on time, every time. Your child's first immunisation, if you consent, is given at birth. This is the hepatitis B vaccine, and it has the greatest benefit if given within 24 hours of birth. The next vaccines are given at 6 to 8 weeks old, and these vaccinate your child against diphtheria and tetanus, two serious bacterial illnesses, and pertussis, or whooping cough, a highly contagious, life-threatening bacterial infection that causes uncontrollable violent coughing. Your child will also receive another hepatitis B vaccine, a pneumococcal vaccine, a polio vaccine, a haemophilus influenza vaccine, and an oral rotavirus immunization. Pneumococcal vaccine provides protection against multiple infections caused by the Streptococcus pneumoniae bacteria, and rotavirus is the most common cause of diarrheal illness in infants and young children. Your child will receive the same course of vaccines again at 4 months of age and will receive a third dose of diphtheria, pertussis, tetanus immunization and second doses of polio and haemophilus infant vaccines at 6 months of age. They will then receive a measles, mumps, rubella vaccine, a meningococcal and another pneumococcal vaccine at 12 months of age. Though these are recommended by multiple agencies, it's ultimately your choice whether or not you vaccinate your child. However, it is important to understand the long-term implications of this. In Queensland, the Public Health Act gives early childhood education and care services the option to refuse enrolment of an unvaccinated child, and the Social Services Legislation Amendment, No Jab, No Pay Act of 2015, reduces the eligibility for certain national subsidies and benefits for non-vaccinated children, such as Family Tax Benefit A. Jaundice is one of the most common medical conditions requiring attention in newborns. Around 60% of full-term babies will develop jaundice within the first week of life. In medical terms, jaundice is a sign of elevated bilirubin in the blood. Babies with this elevated level of bilirubin present with a yellow tinge to their skin, mucous membranes, and eyes. Mild jaundice may continue past the first week of life, without an underlying cause being determined. Jaundice is usually harmless, but in all cases, your baby should be seen by a health professional. It is advisable to see a doctor if your baby is unwell, isn't feeding well, is not gaining weight, your baby's bowel motions become pale, or if the jaundice hasn't gone away in 2 weeks. If your baby is diagnosed with neonatal jaundice and is otherwise healthy and well, no treatment is required, and the liver will process the bilirubin over a few days. However, if your baby does require treatment, it is usually done phototherapy. Blue lights placed over your baby that assist the body to break down bilirubin in your baby's skin. Alternatively, your baby will be placed on a bili blanket that provides direct blue light source to their skin. This treatment usually takes 1 to 2 days and requires regular feeding every 3 to 4 hours to prevent dehydration and increase bilirubin extraction. The Healthy Hearing Program is a free program aimed at identifying babies born with hearing loss. The screening process is performed by a trained nurse or midwife after getting parental consent. The nurse will place small sensor pads on the baby's head and record their response to a soft clicking noise that is played through earphones. The baby will then be given a pass or refer result. If your baby receives a refer result, they will need to be retested. It is important to understand that hearing changes over time, And if you're ever worried about your baby's hearing, you should contact a medical professional. Recognizing common hearing milestones in the first 12 months is a simple way to monitor your baby's hearing development. From birth to 3 months old, babies should settle to familiar sound and startle to sudden noises. From 3 to 6 months old, babies should attempt to turn their heads to interesting sounds, wake easily to loud sounds, and begin baby talk or babbling. And from 6 to 12 months old, your baby should understand simple words such as yes, no, mum, and dad, and attempt to copy these speech sounds. Even though every baby is different, if you are ever worried about your baby's behaviour or health, contact a health professional as soon as possible.